So continuing with our discussion of the lower limbs of the legs, we are going to talk about the 3 bones of the legs, and in the next video we'll talk, really I should say 4 bones if we count the patella, and then we're going to talk about the foot in the last video. All right, so the 3 main bones, the long bones of the leg, are the femur. Okay, we can always identify it because it's the largest bone in the body, and it's going to have this really large, obvious ball portion of the ball and socket joint of your hip. All right, the tibia, which is this next really thick bone right here, and your fibula, so remember little fib, and then your patella, which is going to be your kneecap, essentially. All right, so the femur first articulates up here with the coxal bone. All right, so let's take a second to look at everything here on the full skeleton model. So looking at a posterior view, this is the coxal bone. Let's kind of turn it to a lateral view. All right, here's the femur right here. It's going to articulate down with both the patella, which is your kneecap, and with the tibia. We have the fibula on the lateral side, and then that's going to, both of those are going to articulate there with the tarsal bones. All right, so let's talk about some of the features first of the femur. Slide these others out of the way. So the femur has a very obvious head. So this whole rounded region is the head. And then we have a neck. Unlike the humerus, we only have one neck, so it's just called the neck or the anatomical neck. And so head right here, this whole rounded portion, and then this is the neck where my thumb is. And then we talk about some special features. We have these large raised bumps right here that are called trochanters. So the greater trochanter up here at the top, this large bump on the other side of the neck. And then the lesser trochanter, and this is going to be on kind of the medial side, closer to the posterior side, okay? So there's the back side of the kneecap, right? And here's where we're going to articulate back in with the coxal bone. So that's the lesser trochanter. This is the greater trochanter. Then we have the gluteal tuberosity and the linea aspera. So if we look at it this way, okay, we can see the front versus the back of the femur, okay? So looking at it this way, the head has to be on the medial side, so the inside. So this must be a left leg, right? Remember this anatomical position, and we're facing the skeleton, facing the individual, okay? So if we want to find the linea aspera and we want to find the gluteal tuberosity, we need to look at a posterior view. So let's turn it around. So where that large indentation is on the bottom, okay? So greater trochanter, lesser trochanter. This area right here that looks almost like a V, that's the gluteal tuberosity. Okay, so a point of muscle attachment. And then it works its way down to this very defined line. You can kind of see it at that angle. It goes down kind of where my thumb is and keeps going down. That's the linea aspera. So gluteal tuberosity is this V. And then this line right here is the linea aspera on the posterior side of the femur. All right? And then near the bottom, we're going to have essentially epicondyles and condyles. Okay, so the condyles are these very large raised bumps that stick posteriorly. Okay, so we have, we established this is the medial side here. All right, so we're at the same side where the big ball of the ball and socket joint is. So the medial condyle, the lateral condyle. And then if we look at the sides, basically we have these other smaller bumps. So these are called epicondyles. So this is the medial epicondyle, medial condyle, medial epicondyle, lateral condyle, lateral epicondyle. All right? And then in between them, right here in this big indentation, we call that the intercondylar notch or the intercondylar fossa. All right? If we look at the femur, we're going to have a special surface right here, and that's where the patella is going to sit, like right here. Okay? So we call this the patellar surface. So on the back, we have the intercondylar notch between the two condyles. On the anterior side or the front, we have the patellar surface where the patella sits right on top. And the only feature of the patella that we expect you to know is the apex. Okay, so that's that point. The patella comes down to a point at the apex. All right? Then if we move more distally, okay, or inferiorly we're going to start talking about the tibia and the little fibula. So first, the little fibula. Okay, and if we can look at it, we can see that there's kind of a raised portion on one side. So this is kind of flattened. But here this has kind of this process, this little feature, okay? And this feature is going to sit right around the tarsals of the ankle. And this particular feature is called the lateral malleolus because the fibula sits on the lateral side or the outside of the tibia. Now, the fibula itself doesn't articulate with the femur. It only articulates with the tibia and with the tarsal bones, okay? Which we'll talk about when we get into the foot in just a minute. Instead, we have the tibia right here that would articulate with the femur. And so we have the lateral, okay, right here, this lateral side, the lateral malleolus. This would be the medial malleolus right here, okay? The medial malleolus is on the tibia. And then if we work our way from the bottom towards the top of the tibia, we're going to have the anterior crest. So we're looking on the anterior side. Okay, the anterior crest, this ridge line. We're going to have the tibial tuberosity. So if I pick this up, you can kind of see this raised bump. Okay, so the anterior crest works its way up towards the tibial tuberosity. Okay. And then we have two condyles. So the condyles are going to be near the knee again, all right? We're going to have the medial and the lateral condyle here and here. You can see them also from the back. So here and here. And then we're going to have this raised portion in the middle, where my finger is on the back here. See this raised portion? That's called the intercondylar eminence. So condyle here, intercondyle, meaning between, and eminence, meaning it sticks out. It's a process, okay? So again, to find which side is medial, look for the medial malleolus on the bottom, on the more distal portion of the tibia. That means this is going to be the medial condyle, and the other is going to be the lateral condyle. All right? And those are the features of the bones of the leg. In the next video, we'll go into the details on the foot.